So we are live. Good afternoon, everyone. Today is the last day of International Breastfeeding Week, and Impact Health brings to you two eminent experts to deliberate on empowering parents to enable breastfeeding. We have with us Malwa Kesoski, international parenting coach and trainer for over 20 years. She brings in evidence based teaching to great corporations. She has studied psychology, sociology, pedagogy, online pedagogy, counseling, project management. Well, I must tell you, she has two bachelors, two masters, and one postgraduate degree. My God, she has had a lot of breast milk and she has a lot of energy. She is a parenting expert and couples counselor for last 10 years, helping families internationally to thrive at home. She works with doctors, practitioners, corporations, and individuals. She is an international best-selling author. She's a mom of three. She has breastfed feeded for a total of 43 months, and she has helped families during the first stages of breastfeeding and weaning. So let's welcome Malwa.
Thank you, everyone. Hello, everyone. Thank you, Kulpreet, for having me. Dr. Amita, it is a pleasure to be here with you. I hope that everyone is as excited to be here as I am. Thank you for the beautiful introduction, Kulpreet.
Yes, thank you, Malwa. We have with us Dr. Amita Kaul, Associate Chief of Pediatrics and Neonatology, Surya Mother and Super Speciality Hospital, Pune. Dr. Amita is a trained pediatrician and intensivist. Over 15 years of experience in managing common pediatric ailments, emergency, and childhood asthma management. Her area of expertise is her core specialty management of extreme preterm babies, difficult airway and IV access in NICU and PICU, pediatric asthma and respective ailments, and pediatric nutrition. And well, that's the topic: breastfeeding. How nutritious is the best breastfeed milk? Welcome, Dr. Amita.
Thanks, Kulpreet. Thanks for having me here. And we are going to focus mostly on simple things, nutrition, which may not be as simple. Airway and IV may be very important in an ICU, but breast milk has its own role. And it is something which are going to make the preterm micropremi grow. So I'm very happy to be with you guys. Hi, Malwa. Good to meet you.
Yes, thank you, Dr. Amita. Well, I really, if you look at our topic, it is empowering parents to enable breastfeeding. So let me start with a question, and I would, go to Malwa and then to Dr. Amita. Is who will empower new moms in modern era? If we go to olden days in India, we had a joint family structure. There were so many people around to train and empower mothers. And now in nuclear families, parents are essentially clueless. So what's to be done?
Well, thank you. That's a beautiful question. Being in a nuclear family, we sometimes feel that we're alone. And so with that feeling of loneliness and a little bit of anxiety and maybe feeling lost with having a newborn in our house, we start to look for advice. And one of the places people turn to is the internet, where in the internet, we find a lot of things that are evidence-based, so research-based, but a lot of things that are just garbage. Just like there's different kind of food in the store, there's junk food and there's healthy food. That's the same amount of information you will find and quality of information online. So nowadays, parents turn to the online world to get their answers, and sometimes they don't find the answers they need, or they get overwhelmed and even more stressed than they were at the very beginning prior to searching. Yes, it's best to turn to family and friends because these are the ones that are closest to us. But we need to take into account also that our family and friends are experts in their area of expertise, not necessarily in the parenting or breastfeeding department. So my personal advice is turn to people who are experts, who will give you the tips or suggestions, or maybe just the backup, the mental backup of you are doing good. Don't worry about it. It's going to be enough. So turn to experts. If you would like an individual consult, that's great, but sometimes you don't need to put money in there, because just like today's video, there is content. If you have experts, you have access to content that doesn't cost you anything. So make sure you turn to experts if you have questions or issues that you want addressed at the very beginning. Now, when it comes to the nuclear family, you are a family. So moms, you did a great job giving birth to your baby. Your baby is in front of you and you are everything that the baby needs, meaning you are sufficient. Although you are a family, you have to take that into consideration as well. You didn't create the baby by yourself. You had a partner with you. Should it be your husband or just a partner? So make sure that you include him in the whole process of bringing up your baby, because you want to feel as a family and no one should be excluded. So again, turn to the person that is closest to you.
Yes, thanks, Malwa. Yes, we need to turn to the person closest to us. So, Dr. Amita, if you'd like to add.
What I see in my practice, that once parents they conceive, everything is going on fine, and once the baby comes, it comes to them as a shock. Now, what do we do with the baby? So the important thing is, I like the conscious parenting advice Malwa gives. We have to be, when we have a baby in our uterus, we have to be conscious that the baby is going to come out. Then what am I going to do with the baby? So we have to talk to the experts about the baby as well. So there are frequent gynecologist visit, but how many of the gynecologists are checking the breast of the mother? Because I see the babies with the mother and the nipples are flat. So then you waste those 3-4 days where the bonding could have occurred. So these things have to be asked if the gynecologist is not addressing these concerns. So mothers and the father, they have to actively ask, so what can we do to achieve breastfeeding? So number one is that, so you have to talk to gynecologist. If prenatally, you can go and meet a lactational consultant who would probably examine your breast and give you a proper advice what nutrition one can take, so that once the baby is there, you're not in a shock. Mothers don't even know how to hold a baby once the baby is there. So it's not just about people telling you from outside, your parents helping you. It has to come from within. Now that you're becoming a parent, you have to become responsible. So people are generally focusing on which hospital, what clothes to wear, the maternity wear, but what happens to the baby? So it should not come as a shock to you. The baby is coming, so you have to be prepared. People will go buy bottles, people will go buy formula, but how many people actually talk to the gynecologist about breastfeeding? How do you think, doctor, I will be able to breastfeed my baby immediately after birth? So that is very, very important. That consciousness has to come. Probably gynecology should also ingrain into them, yes, that breastfeeding should happen as soon as possible. So both the parents, not just the mother, but the father. And we should not always depend on our mothers, because especially in this COVID situation, we have encountered parents who are completely alone, no parents with them, and they are having a nervous breakdown. You have brought the baby in, so you are responsible. So let's step up to that responsibility and take care of the baby.
Yes, Dr. Amita, and very valid point which you brought in, Dr. Amita, that please seek advice from experts. So, and experts are available. If we look at India, India has a very positive healthcare system, and healths are available. Lactation experts are available. Neonatologists are available. Pediatricians are available. We have experienced gynecologists are available. So we have an entire setup of experts available. And you spoke about another thing, Dr. Amita. I would like to, Malwa, to dwell on that. That what assistance fathers can provide in the whole process of breastfeeding. Over to you, Malwa.
Well, I really like the idea of gender inequality and empowering both women and men, and treat them equally. I'm all for it, but unfortunately with breastfeeding, it doesn't happen. Moms, you are the ones that are responsible for it, and you are the ones that are going to be giving your child nutrition. So you are going to give them the best thing that you can ever give them, deciding and choosing to breastfeed. Now, I would like to go to a little bit off topic and say that a lot of moms feel this sense of anxiety because they know breastfeeding is so important, and they stress that they don't have enough milk at the very beginning. So the first 2-3 days, they're overwhelmed because they think, oh my goodness, I don't have enough milk. Okay. So moms, don't worry. If you listen to your body, if you listen to your baby, it's going to happen. But the less you stress, the better it is. And having that taking that into account, that mindset is important. This is where the dads come in. So dads, yes, you are not going to be able to breastfeed, but you are there to take care of your wife. She just created a miracle. She's a miracle worker. She gave birth to a healthy, hopefully, child. And she is the one that is making sure that your family name has another generation to serve. So you are also responsible for taking care of this woman. I'm not saying do everything in the house because of gender differences or because of, for example, cultural differences. You might not be used to it, but you know what? Your wife will sometimes forget to feed herself, and she will sometimes forget to hydrate herself. Hydration is very important in breastfeeding because she is feeding with her body another human being. So dads, if you just come up to mom and say, honey, I brought you a glass of water, or I brought you a sandwich, I hope that you're okay, and you just give her a pat on the back, that is going to be enough. Okay? That is going to be enough support to say, you're doing a great job, baby. I know it's hard. Let me help you. I'll do the dishes. I know that sometimes it's hard, but you know, dads, you have to step up. You have to take care of the woman as well. Now, moms, give dads a little bit of responsibility as well. So for example, after mommy finishes breastfeeding the baby and the baby is milk drunk, daddies, take off your shirt and do a little bit of kangarooing. Put a baby skin to skin contact on your chest and let your chest breathe and massage the baby's belly. So the baby's belly is connected to your belly. Every time you're breathing, this kangarooing is actually creating a sense of closeness, bonding, and physically helping the baby digest the milk because their intestines still need to develop a little bit. So dads, you can do a lot. Remember, support is most important for both mom and the baby.
Wow, so kangarooing is something I learn. Okay. So fathers, please learn kangarooing and reach out to Malwa on her, social media handles, and maybe she can teach. Dr. Amita, would you like to add something here?
Yeah, I would just say that post-delivery, there's a lot of postpartum depression, and the father should, or the husband should be there for the mother and support emotionally, as well as they're feeling a little weak post-delivery. A lot of mothers are undergoing cesarean C-sections, so they need little more help with sitting up, with holding the baby, so fathers can step in there. The other thing is, I don't want the fathers to pressurize the mother to, you just breastfeed immediately. If whenever she knows her responsibility, so she is going to breastfeed, there should not be any pressure from the partner. So they should help her hold the baby, latch the baby, probably help in the burping, post feeding, change of nappy. So everything the mother is not doing. And as Malva mentioned, nutrition is very, very important. Hydration is very important. So mothers should not skip their meals. They should be eating meals at particular time. Breakfast, lunch, and dinner should go at time. So the father can make sure that mother is at least getting those meals in time, as fluid continuously when she's breastfeeding. There should be a mug. I always tell my patients, there should be a mug with you when you're breastfeeding. You may drink tea, coffee, or you may have milk or water, whatever, but keep yourself hydrated. And the atmosphere around should be pleasant. They should make sure that probably some music is going on. And kangarooing is a very good way where fathers can also bond with the baby. Mothers absolutely would kangaroo, there's kangaroo mother care, but their fathers generally do not, they're very scared to touch the baby. So that bonding has to come between the baby and father as well. So kangarooing is a good this thing. Plus gentle massage. Indians do a lot of massage to the babies. Now the grandparents are out of the picture in this COVID situation. So fathers can step up and probably start with gentle massage of the baby, probably a light warm sponge, light music, just to make the baby calm and allay the mother's anxiety as well.
Yes, yes, yes.
Speaking
Malva.
of massage, dads, Mom would like a foot massage too. So after you're done massaging the baby, mom's foot massage would be nice as well.
Good one. That's like really, that's like icing on the cake.
There's another thing that nowadays, because I'm from Canada, so in Canada and United States, there's a thing called a care basket, which is you find a basket, and in that basket, Dad, you can make sure that every day in the morning before you go to work, you replenish that basket. And in that basket, you put a new bottle of water for mom, maybe a snack, maybe an apple, maybe a burping cloth, or even a book. Sometimes the babies eat for such a long time that mom is tired and she needs a rest. So maybe give her a magazine or a book, and everywhere she goes, all she has to do is take that, care basket with her. And when she's moving between different rooms of the house, and she knows you care for her because you make sure that you replenish that basket when you're gone and you're not able to fetch her that glass of water when she needs to. So here's another tip that dads can step in.
Wow, that's pretty interesting. Great. So my next question to both of you is let's start with Dr. Amita. Is breastfeeding a complex process for mothers, and can you explain the process and empower them so that they are at ease of doing so?
See, breastfeeding is very natural, and it is something which is very easy to do, because if you are giving formula, you're washing bottles, you're making a formula, and here it's a renewable food for the baby, and it's natural. So you don't have to warm anything, you don't have to do anything. You just have to hold the baby properly. The most important point here is the latching, where you should know where the baby is actually latching on the areola, which is a dark portion around the nipple and not on the nipple. That is where most of the mothers go wrong, because once the baby latches improperly, it hurts. And once something starts hurting, then there's a little aversion that it hurts. I don't want to do this. So it is very important that latching should be proper. They should be able to hold the baby well, and they should not look at the milk supply, especially in the first couple of days. They may just be making few drops of colostrum, and one has to know that colostrum is an immune booster. Right now, in this situation, we need immune boosters for our babies. So make sure that baby gets that drop of colostrum as well. So probably frequently you will have to latch your baby, and mothers have to make sure that they're very comfortable. Sometimes mothers make themselves most uncomfortable. They sit in a most uncomfortable way to hold the baby because they really want to feed the baby. But they have to realize that if the mother is not comfortable, baby can never be comfortable. And once the mother is uncomfortable, she's anxious, all the anxiety hormones from the mother pass on to the baby and cause a lot of gas, a colic. So it's a vicious cycle which happens. So mother is crying, baby is crying, and mother is crying. So main thing is mother has to be very comfortable. She has to be in a proper position. She may take help of pillows or whatever way she can hold the baby properly. Make sure the latching is proper and she is well hydrated. And she should, sometimes the most important question that comes is, am I feeding the baby properly? How do I know whether my baby has got enough milk? So simple thing is, the urination will tell you that whether your baby has got enough milk or not. So on day one, the baby has to pass urine just once. So if you are able to do that with breastfeeding, you are doing a good job. And on day two, because your milk is going to increase, the urine output of the baby is going to increase to 2 times. So the day of life of baby is equal to the number of urine the baby minimum should pass. So if that is happening, you are doing it the right way. So it is very important that the anxiety should go away, and mother should confidently make sure that she's able to give that important colostrum from the go start.
Okay, great. Thank you, Dr. Amita. Yes, Malwa, over to you.
I'm in awe what Dr. Amita is saying, because this is exactly, I'm nodding my head because this is exactly what I tell my parents as well. The first and foremost is, like, a lot of moms don't realize that the first milk is like an immune booster, and they don't realize that this is the best thing they can give. It's like a golden drop that is very rich and dense in fat and calories and a lot of the nutrients that the baby actually needs. Furthermore, the baby's digestive system is going to be is going to be learning to digest, because the baby was not fed this way, not through the mouth, at least while the baby was, in your belly. So right now the baby is learning too. And if you are going to give the baby formula, then the baby is going to eat too much, having belly aches and being out, meaning sleeping for extended periods of time, because the baby is trying to preserve the energy to digest the formula. Yes, formula sometimes saves lives, and it's the best thing that a baby can have if they can't be breastfed. So I'm not being against formula, but I'm just telling you that a lot of babies drink too much formula. Now, in hospitals, very often parents ask for formula and the babies are given 20, 30 milliliters of formula in the first day. Comparing that to what Dr. Amita just said, that the babies just need a drop or 2 or 3 of the first milk, 30 milliliters of formula is like you parents going to, let's say, a restaurant and eating 3, 4 big meals. You will be out and sleeping like a bear in hibernation too, because your energy will be used not for being active, but for trying to digest this big chunk of food in your belly. So take that into consideration. Babies need very little food at the very beginning, so that tiny amount of food coming out of your breast is completely enough. Now, moms, if this is your first or second day in the hospital, squeeze your areola, squeeze your nipple. If you see just a tad of something yellowish white coming out, you're doing a great job. You don't need anything else. Okay, that's enough for the baby. Doctor said that, Amita said that you need a proper latch. Yes, children sometimes don't know how to latch properly. Moms, I'm going to send a poster to Kulpreet, and we'll include it if she'll allow us, on the Impact Health as to what the latch should look like. Okay. Yes, your breasts are very big and the child's head seems very small, but their mouth can open wide. Okay. So imagine eating a hamburger. Your child has to open their mouth wide. Sometimes they don't know how to do that either. So you've got this magic thumb. Just hold the child's chin with a thumb to help him open his mouth, and then squeeze your breast a little bit and put it inside the child's mouth. The child is learning as well, just like you, okay? The child knows that he naturally has to suck, but how? He's learning or she's learning. Moms, give yourself some grace. You're doing good. So don't stress, because like Dr. Amita said, those stress hormones will come into your baby. You don't need that. You want it to be a joyful period. And last but not least, Dr. Amita also said that, I'll just add one more sentence. If your nipples hurt, sometimes they will. Okay, I breastfed, like I said, for 43 months in total. And I know at the very beginning, your breasts need to be a little bit more durable. So you can prepare your breasts prior to giving birth, and your nipples as well, by massaging them gently. Okay, there are brushes or sponges that you use to actually exfoliate your skin. Try massaging and exfoliating your breasts prior to giving birth to make them a little bit more tougher. And then after your baby starts sucking, if you look at the tongue, there are little bumps on your tongue, and that is going to hurt you a little bit at the very beginning, but that's fine. Take a little bit of that golden drop that I said, if you squeeze and massage it on your nipple and your areola and let it air dry, and that is the best medication for your breast to kind of regenerate between the breastfeeding. Everything is possible, but just try to be as happy as you can, because you just gave life to a new person.
Yeah, thanks, Malwa, for adding so much value to the conversation. Now that you spoke about, the first drop of milk, tell us that this first drop of milk or breastfeeding, does it, protects babies from infections? Dr. Amita.
Breast milk has a lot of properties, and as per UNICEF and WHO, if mothers exclusively breastfeed for even 6 months, the death rate is going to go down by 8 lakh. We are going to save 8 lakh babies if mothers exclusively breastfeed for 6 months. So that is how powerful breast milk is. Breast milk reduces not only the gastroenteritis, diarrheas, it reduces the respiratory tract infection. So a breastfed baby would have 50% less chance of developing diarrheas, 1/4 less chance of developing respiratory tract infections in the early age group. So 5-year mortality of children can be reduced by just breastfeeding. That's the most important initiative as told by the UNICEF and WHO to reduce 5-year mortality in children. So this is how powerful breast milk is. So babies who are not breastfed, they have 3 to 4 times more chances of developing infection. Breast milk will, as we already discussed, would improve the immune function of the body. It is very light. So, and it has the quality of protein is very high. Though it's very light, but the quality of protein is very high. It is going to protect the gut from allergies, which is very high these days, especially in the developed world with infections going down and allergies up. So it reduces the chance of developing food allergies, skin allergies, and it prepares the digestive system for life. Not only that, these are just the infections we are talking about, but breastfed babies have chances of being less obese, and the chances of getting type 2 diabetes in babies who are breastfed is significantly lower. And in breastfed babies, there are 50% chance that infant deaths, which happen, SIDS, which we call sudden infant death syndrome, is reduced. So it's like a miracle fluid. And if given to babies, it can just not only change their infection profile, but also it increases the IQ by 4 to 5 points. So breastfed babies are supposed to be more smarter. I'm not against too much of formula, but still breastfeeding is the way to go.
Thank you for adding so much value, Dr. Amita. Maya, would you like to add something? And we have some questions coming in, and I'll take those questions as well. Yeah.
Okay, so I just wanted to add the difference between breast milk and formula. We have to realize that formula is God sent to all the moms that can't feed. So I do not want any mom who is listening to this or any family to feel ashamed that they're formula feeding their babies. No, but this is Breastfeed Awareness Week. That's why we are concentrating on breastfeeding, which is amazing. Now, moms and dads, realize this. Formula milk is nothing but genetically modified cow's milk. Cow's milk, okay? So if you're a vegan, formula milk is animal-derived milk. What is more, if you look at the makeup of a calf is born quite big. And within the first year of life, the calf feeds on the mom's milk, so the cow's milk, and the calf grows 300% between its birth weight and the first year weight. So this is in accordance to what Dr. Amita said, that breastfed babies don't grow 300% because that is not our goal as humans, as Homo sapiens. We don't need to grow 300% in the first year. So children that are breastfed have less probability of being obese because they're not being fed that milk that is pushing you to grow. So another misconception that happens is we look at the growth charts, the centile charts, and a lot of the time moms or dads or even doctors compare the size of the child to those growth charts. You know, are we on the 10th, 15th, 20th, or 97th percentile? And we say, oh my goodness, my child is not as big as he or she should be when he or she is breastfed. Okay, don't compare. Just compare the child to the centile that he has been born in, and is he growing in the same centile? Don't compare it to the other children. And another thing is breastfed babies are smaller because these charts were done on formula-fed babies. So technically, these are old charts. These charts were made when the formula-fed movement was happening a few decades ago. So moms, rest at peace. Your babies are fine if they're eating, if they're passing urine, if you're changing diapers and you think, oh my goodness, there are 12, 15 diapers a day, you're doing good, okay? You're doing fine. Another thing that you should take into account when it comes to breast milk is that There are 3 types or 3 levels of meals. Let's say when you eat in a restaurant, a full course meal, you'll have soup, then you'll have dinner, and then if you're lucky enough, you'll have dessert. Well, that's exactly what happens with your breast milk. It changes at the very beginning. It's very rich for the child, and then it's watery, and then again, you'll have that fat syndrome, so that dessert. So depending on the weather outside, your breast milk, mom, changes. Depending on the viruses or the bacteria that your body is fighting that you're not even aware of, your breast milk is changing, and you're giving those antibodies to your child. What is more, the way your child cries and behaves, your body knows that he or she might need something, and your breast milk changes as well. Okay, this is the miraculous thing about breast milk. It changes to the needs of your body and your baby's body, taken into account, for example, the weather as well. So if it's extremely hot, your breast milk will be very watery. If it's starting to be cold, your breast milk might be a little bit thicker because your child will need more nutrition. And if you don't believe me, moms, if you're breastfeeding right now, why don't you do a little test? Okay. Extract some milk and put it on the counter at different times of the day. And then you'll see the proportion of the 3 layers will be completely different on the 3 times a day. So you'll see that what I'm saying is actually true, because the fat layer will be different. The watery bit content will be different, which means that your breast milk is doing a miraculous thing for your baby. Make sure that you use it while feeding your baby.
Wow, so much of knowledge. I hope that a lot of lactating mothers listen to it. Dr. Amita, you would like to add something? And because
Yes, I agree with Malva about the growth charts. So what is important in the growth chart is your child is on the same centile as the baby was born. The baby should not drop from the growth chart. You don't have to achieve even the 50th centile or never the 97th centile. But if your baby is on the 5th centile and he continues to be on the 5th centile, that's fine. Your baby doesn't have to jump centiles. Jumping centiles either up or down is not good sign. That's all I wanted to add.
wow, that's a value add. So thank you, Dr. Amita. We have Anmol Gupta. I think she has 3-4 questions. So I'll put one by one. The first question is, what's the maximum time a baby can be breastfed, and time period in early months? Yes, Dr. Amita.
So breastfeeding is what we say, it's demand feeding, and some babies can just feed for 5 minutes, and some babies want to latch for half an hour to 1 hour. So as I told you, whether your baby is getting enough milk or not is told by the diapers you change. So if you continuously breastfeeding your baby for an hour, like a 7-day-old baby is feeding for 1 hour, generally they're supposed to pass urine within half an hour or 1 hour of completing the feed. If that is not happening, probably the baby is not getting enough milk. So probably it's the time to switch the breast or hydrate yourself more so that you make more milk for the baby. So there's no time duration. Some bigger babies, they just feed for 5 minutes and they are able to empty the breast. So baby should become calmer after feeding. You should feel light on the breast after the baby has suckled on the breast. And the third thing, which is most important, which I keep telling the parents, make sure your baby is passing enough urine. So minimum urine for a 7-day plus baby should be 7 to 8 times. That is the amount of feed you are giving to your baby, which is like 3 or 2 hourly or even sometimes 4 hourly. Depends on how much the baby wants.
I understood the question a little bit differently. So what's the maximum time a baby can feed? I understood it in years. So whatever you feel comfortable with when it comes to years time, the minimum we say, or the WHO says, it's 6 months to 2 years or further. It's your choice how you want to organize your family. When it comes to the time per feed, like the doctor said, feed on demand. And moms, sometimes you might feel that your baby is feeding more one day and less the other day, and then all of a sudden within a week you think my baby is just attached to my breast constantly, like leave me alone. Sometimes you have those feelings, but then you have to realize that your babies are very smart. So they know when they're going to have a growth spurt. So they're trying to prepare your breast to give them more milk in a little bit. Okay. So every time your baby latches onto your nipple and to your breast, that is a signal for your body. Hey, produce some more. So when the baby is latching on, that is when the baby is saying, I'm going to need more food, so I'm preparing the breast to feed me more food later on. I don't know about you ladies, but I found slings or ring slings very helpful for moms. So these are like cloths that you put on your body, and your baby is actually lying down in a cloth where you're breastfeeding the baby, and you can still walk around the house. So slings were a lifesaver for me, and they're a lifesaver for the parents that I work with at times, because they free up at least one of the hand the mom has, so the mom can go and put on some makeup and look pretty while breastfeeding at the same time.
Absolutely. And yes, Anmol is saying thanks, Malwa, because I believe she was asking the time period, 6 months, 1 year, 2 years. So I think
minimum 6 months is the need, and after 6 months, it doesn't mean that you stop. After 6 months, this is where we have complementary feeding. So we start feeding other elements of dietary food, let's say, to the baby. Now, before we actually introduce anything, there are two things that I want to address. First and foremost, moms, dads, don't listen to consumerism experts. Okay, so a lot of the things that are happening right now is advertisements are bombarding us with, give your baby that is 4 months old tea or juice or, some cereal. At 4 months, they really don't need anything. Moms, they just need your boobie and that's it. Okay, after 6 months, this is when you start noticing your baby. So again, it's not the time frame that matters. It's your baby that should be listened to. So 3 milestones. If your baby can sit, so his head is straight up and it's not wobbly and not falling, that means that his muscles, the neck muscles, are strong enough. That's the first milestone. The second milestone, your baby starts reaching out for your food. That is the signal, he or she is starting to be interested. Okay. And second of all, your child is doing that movement of grabbing something and putting it in his or her mouth. Those are the 3 steps that you have to take into account before you actually start complementary feeding for healthy children. So for example, for my 3 children, my firstborn started at 5.5 months. That's when I noticed that he was doing all of the 3 things. For my youngest, and she was 7.5 months, and that is when she started to sit upright. So I'm like, okay, 7.5 months, this is when you're ready. So again, just like looking at the 3 of us, we're all beautiful, but none of us look the same. The same happens with the babies. More or less 6 months, but you have to listen to your baby. He or she will tell you. If I can sit and hold my head upright, if I am reaching for your own food, I'm showing interest to what you're eating. You'll sometimes breastfeed your baby and you'll realize that when you're eating an apple, he or she will start grabbing at the apple and wanting to put it in his mouth. That is the sign that the baby wants to try other food, but that doesn't mean stop breastfeeding. Absolutely not. Breastfeeding should still be the number one source for your baby until 12 months. And then later on, whatever you're comfortable with, mom and dad, because I know that some moms go to work and they feel that, oh my God, I need to feed until the child is 3 years old. No, don't put stress on yourself and on your body. Make sure that you make it right for your family. Aim at minimum 6 months, ideally 12 months. Everything else is added value. Some parents that I work with feed until the child is 4 years old and up. So your choice, whatever works for your family.
Right. Thank you for that. Anmol is asking another question. I don't know how relevant it is, but she's asking, being alcoholic, can it affect, breast milk?
Yes, obviously, alcohol is a negative substance for breast milk. It reduces the breast milk production, as well it passes on from the breast milk to the baby, and the baby becomes drowsy. So obviously alcohol is a big no when we are especially in the first 6 months of breastfeeding.
Now my next question is, there are times, a mother is in today's times, when there is a lot of infertility happening, though in lockdown there have been abundant of babies, but infertility is an issue here in India and worldwide. And through IVF, if the choice of treatment is IVF, there are multiple pregnancies happening, and there are twins and triplets. This is like common. So how does a parent of two feed?
A parent of two feeds the same way as a parent of one. Put the baby to the breast properly, the baby eats. No, I'm laughing. The whole situation is you have two breasts. So if you want, you can have feeding pillows and feed the babies at the same time. Now, one of the things that you can do, I'll stand up a little bit so you can see. Generally, when this is the baby's head, you would hold the baby across your body and feed it right here. But if you have twins, you can take the baby's head, put them at here, and the bodies are sideways. So you can actually feed both of your children at the same time. Again, I can give you a poster to show you the different positions on how to feed twins. It's possible. I mentioned a few minutes ago, every single time a baby latches on your breast, that is a signal for your breast, hey, produce some more. So now imagine if you have twins latching onto your breast, they're going to give information to your body, produce some more. So your body is going to have enough food for the twins. Very rarely do I ever come into a situation where I tell the moms, go to a healthcare provider, make your doctor see your babies, because of the supplementary feeding that you might take into account. Very, very rarely. So moms, your bodies are going to do fine. One of my clients has, I already mentioned it to the ladies, has triplets. So she has 3 babies, 3 newborns, and she's feeding them. She's rotating the breast. She's rotating the babies. She's able to feed 3 babies. And what is more, she is still supplementarily feeding her toddler, so her 2-year-old, at the same time. Of course, the 2-year-old doesn't eat as often as the triplets. She just does it for emotional bonding, and she chooses not to wean that baby off eating. Yet she's capable of feeding 4 babies. Trust me, your body knows what to do, and you'll do fine having twins.
Wow, that's like an amazing example. I'm feeding 4 at a time. My God. So is there Dr. Amrita, would you like to add? Because I have another
Yes,
question.
when we are discussing IVF here, and with twins and triplets coming in, a lot of preterm babies are happening. So if the baby is a preterm, less than 32 weeks, obviously the baby will not be able to latch on the breast. And for such preterm babies, it is very, very important that mother sends the express breast milk. So there comes the role of breast pump and expressing the milk. So preterm babies are happening. We have a lot of VR and ICUs full of preterm babies, extreme preterm babies, smaller ones, less than 1 kg, 500 grams, 1.5 kg. So all of them, the main thing besides intensive care, what they need is breast milk. And a lot of time what we face in first 48 hours, the mother is completely in stress and there's no milk, and we are forced to give formula. But right now in India, we do have an option of pasteurized human donor milk, which is available. So we are resorting to that, but super costly. But still, I would say, again, conscious parenting, you're going to have twins. So it has to be in your mind that I am going to have twins and I'm going to breastfeed and I will make milk for my baby. So that positive reinforcement is very, very important when we talk about breastfeeding, because the breast milk doesn't come, it comes from the breast, but the signals come from the brain. So you have to have positive things that I have to breastfeed and my baby needs my milk. So with that attitude, if the mothers start producing milk, because we need like 1 ml or 2 ml for preterm babies, so that amount of milk is not too much in the first 24, 48 hours. So it's all mother dependent. And yes, it's dependent on the physician who's taking care of the mother. So it has to be imbibed in her, not only the mother, but the father as well, that they have to support the mother to produce that milk for the preemies and the micro preemies. That is very important. And yes, twins, they are ready to breastfeed. Like with the singleton, twins can also be breastfed. But that mental block comes. I have twins, I will not be able to breastfeed. So formula comes, the bottle comes before the baby has arrived. So that mental block has to go away. That is very important, because once you know I'm going to have twins, so I'm sure I'll need formula, so I don't need to breastfeed. That thought has to go away. even with twins and triplets, even with preterm babies, mothers and the parents, both the parents have to be determined, yes, we will be producing breast milk for our babies. That is very, very important.
Yes, thank you, Dr. Amita, for adding that value. And I have been to Surya Hospital's NICU department, and it's like a miracle house. It's like a miracle house because you see 400 grams, 500 grams, this much babies, and how the experts are taking care of them. It's like amazing. And Surya Hospitals in Mumbai also has a milk bank wherein mothers who are have more milk, they are donating milk for these preterm babies, so which is phenomenal. And another thing which I like, which Dr. Amita said, is that positive thinking is like really important. I never knew that you guys will come up with this thought, because I am a believer in manifestation and thoughts. And and doctors believe that thoughts play a very important role. Well, wow. So mothers think that you can produce abundance of milk, and the universe will give it to you. And another thing which was coming in my mind, yes, Malwa, is there in a way that milk production can be increased through doctors, as in through medication?
I think the medication part is for Dr. Amita. I just wanted to add one more thing about the mentality. Imagine this. I was pregnant. I was 8 months pregnant. So my body was completely not ready yet for breastfeeding. I am going into the office to my corporate customer. I'm about to have a training session with them, being 8 months pregnant. And all of a sudden I hear a newborn crying. And I'm shocked because I look at my shirt and my shirt is wet. Okay, my breast milk came in because I heard a newborn crying while being pregnant. And it has nothing to do with anything but the mother's brain hearing a newborn crying. My body reacted for the first time, and I had to put a scarf on my shirt having a training session with my corporate customers because, my body reacted to external factors. So if that happened to me personally, imagine dads, everything that you do affects the mom as well. Mom, everything that you're listening to, being positive or negative, is the choice that will affect your body as well. So make sure you do have positive aspects, and even play some calming music if you choose to while breastfeeding, because that will actually lower the level of the stress that you have in your body, making breast milk a little bit easier. Dr. Amita, to you about the medication, because I don't want to step into your level of expertise.
I'm a pediatrician, so medication is from the gynecologist. But yes, there are medication which do enhance mothers who are not able to produce enough milk for the babies. And there are some galactagogues, there are some supplements which the gynecologist would like to give to the mothers so that they are able to produce enough milk. But personally, I feel it's more of nutrition, positive thinking, and a lot of fluids, which is very, very important. I came across a very interesting study while I was reading for breastfeeding. So music therapy, it's important. It plays very important in the milk supply. So, am I audible?
Yes, I think there is an internet lag.
Am I audible?
Let's wait.
Yeah.
Now
So
you're audible. Yes. Go.
So I was talking about music therapy. So there's a study where they have studied preterm mothers who come to NICU. For a few hours, they're made to listen to some instrumental music. And then they have seen that their psychological stress score comes down and their milk production increases. In 4 days of music therapy, mothers are able to produce more milk than mothers who are not subjected to music. So music is another way of making milk. So you don't have to resort to drugs for everything. So breastfeeding is a very physiological thing which comes once you as you become pregnant and as you have a baby. So the milk will come. I always tell my parents that God has given you a baby, it will give you milk as well.
Yes. I think there is internet lag with Dr. Amita.
If I can add something about breast milk and the lack of breast milk. So in the modern world, unfortunately, and this is one of the things that I have to fight with every single day with the parents that the young parents, you don't need to bounce back, meaning you don't have to have an hourglass figure within the first 3 days of giving birth or even 3 months. So moms, everything that you do for your body postpartum is quite important, but please take into account your baby. So if you're trying to cut down on their calorie intake because you want to fit in your skinny jeans, that is not the best mental approach. Your mental approach should be, let me feed my child. You know, your body will be back to whatever shape you want it to be later on. But right now, your child is most important, and learning to cooperate with your child. So a lot of the moms that I have to work with are moms that have a lower milk supply because they're cutting down on calories, or a lower milk supply because they don't want to drink so much because water retention and they want to have a lower weight. That's not possible. And physical strenuous exercise like cardio and running while you're breastfeeding might not be the best solution for you either, because it hinders breast milk. Every time your breasts bounce, it hurts. So give yourself some grace. After a few months after you're established, this is something that you will look into at the very beginning. Give yourself grace and know that you have just made a miracle come true by giving birth. Let nature work with you, feed the baby, and your body shape, and if you want to lose weight or not, is up to you, but later on. So give yourself some grace period, because I have moms who are cutting down on calories, cutting down on milk, and extreme exercise routine, and the child is only 1 month old and they wonder why they don't have breast milk. Okay, please don't do that. Okay, make sure that you're feeding your baby first, and later on your body will come back to its normal shape.
Thank you, Malva, for adding that value. Dr. Amita, you wanted to add something?
Yeah, I want to add to it. A lot of our film celebrities, Kareena Kapoor and you name few, then when they have babies, they start losing weight, they put on weight, and suddenly in 3 months they're back to shape. So that is a very wrong example to follow. What I would say, breastfeeding. If you breastfeed, your uterus is going to contract faster. You're going to get into shape faster. That is very important. Rather than going to a gym, you breastfeed your baby for 6 months, and after 6 months, once the complementary food has started, then your muscles from the pelvis are also ready for exercise. You will get a hernia otherwise if you exercise early. So after probably, I started exercising when my baby was 9 months, and I'm as fit as any Kareena Kapoor. I have a flat abdomen, so I would like to say. And it's all because of breastfeeding. You have to eat well. Yeah, look at my jawline. So it's very important that one has to focus on breastfeeding. If you focus on breastfeeding, everything is going to come in place. You are going to come in place. Your organs, your internal organs are going to be back in shape. Your breasts are going to be back in shape. Mothers are very worried. What do I do with such big breasts now? Nature is going to take care of them. Once the breastfeeding, with time, your breasts are also going to get in shape. So those things, that aesthetic should come little later. If you care for your baby, I'm sure you will get into shape by 1 year.
Speaking of breasts getting into shape, dads, this is where your role comes into play. You can help mom massage not only the feet.
But Malva is adding a little bit of spice to our talk, so that's interesting. Great. But Malva and Dr. Amita, we are almost towards the end of our chat. It's actually been almost an hour, and it just went by. And I would request Malva and then Dr. Amita to sum up and give some takeaways and recommendations, suggestions to our listeners from our present talk. Over to you, Malva.
Moms, you're doing great. Okay, so your level of stress should be lower. You just gave birth to a child. Your organs are not aligned, like Dr. Amita said. So let your body and the breastfeeding process do its magic, because your body needs to get strong as well. Your mental capacity is quite important. You need to take into account that, listening to music, relaxing, and having a calm atmosphere in the house is going to do wonders for both you and your baby. And another thing, because some babies are tiny, you might want to look into swaddling the baby. So taking a cloth and wrapping the baby up so it's easier for you to hold the baby while you're breastfeeding. Again, I will go to Kulpreet and show her a picture of how to swaddle a baby so she can pass that on to you to make it easier for you to actually deal with this little bundle. And last but not least, remember, the more love you show your baby, the more relaxed you're going to be. Dads, the more love you show your mom, your not your mom, but the mom of your child, the more relaxed she is going to be, the more relaxed the baby is going to be. So try to keep a calm and relaxing atmosphere. It doesn't have to go by the clock. It has to go by nature. Okay, so listen to your bodies.
Wow, I think that was pretty nice. That listen to your bodies and don't go by time, go by nature. So that's a great takeaway. A great takeaway for fathers from Malwa, and I would request all the fathers to listen to the interesting points which Malwa is making to the chat, and especially towards the end. Yes, over to you, Dr. Amita.
What I would want to say is pregnancy is not a disease. What we do consider, because it's happening in a hospital, people are thinking it's a disease, I'm unwell, and people have stopped enjoying their babies. So it's like a big stress for everybody. So one has to realize that it's a natural process. Baby has come. You have to breastfeed your baby so that baby grows well, and you have to enjoy your baby. People have stopped enjoying. People are only looking at negative. My baby is not growing. The neighbor's baby is bigger. My baby is gassy. You have to enjoy your baby. Baby is your reflection. So if you're anxious, as I said earlier, your baby is going to be anxious. So you're rubbing your anxiety into your baby. So be happy, breastfeed with confidence, with father and whatever family support you can get. Eat well, do not cut on your calories, drink lots of fluids, and put that in your mind that breast milk is the best milk for your baby. And for mothers who are not able to breastfeed, as Malwa said, please don't take it like a guilt conscious that I'm not able to breastfeed. There may be some medical reasons, there may be issues with lactational failure. So in that circumstance, just at least try to make milk for the baby. And in the meantime, take the doctor's advice. If the doctor is saying it's okay to give formula to the baby, that is okay. But yes, you have to be focused that yes, you have to make milk for your baby. And with micro premies, what happens that with this talk of empowering, mothers say, I heard a conversation about breastfeeding the baby. You have to realize your baby has to be ready for it. So if your baby is a preterm and it's less than 36 weeks, less than 2.5 kgs, he or she probably is not ready for breastfeeding. So this conversation is for a term baby who is medically fit to breastfeed. So we have to differentiate between that. And if your baby is in the NICU, make sure you're making enough milk for the baby so that baby grows to that gestation and weight so that you can directly breastfeed.
Thank you, Dr. Amita, for summing it up so beautifully. So yes, parents, it is empowering parents to enable breastfeeding. Thank you, Malwa, and thank you, Dr. Amita, for taking out time from your busy schedule. It was a pleasure hosting you, and thank you for accepting my invitation.
Thank you very much, Kulpreet. It's an honor. Dr. Amita, it's an honor as well. It was a very big pleasure to be here with you two ladies. Everyone, thank you for listening, and I hope you have at least one takeaway from this video. It will be lovely to hear from you in the comments what you liked most. Thank you.
Thank you, Kulpreet, for having me. And Malwa, it was amazing meeting you. Somebody so positive. I barely meet any mothers who are so positive as you. So it was a pleasure being here, pleasure to share my experience. I hope it's beneficial for viewers. Bye-bye.
Yes, thank you so much. Dr. Malwa and Dr. Amita, just stay in the backstage. I will be back. So that was Malwa and Dr. Amita with us on this wonderful chat on importance of breastfeeding and empowering parents to enable breastfeeding. Thank you very much, and we shall be back at impacthealth.in with newer and interesting subjects with meaningful insights. Thank you.